Static quadriceps drill exercise. Press your knee down. Tighten the thigh muscle and hold. No movement, just pure quadriceps activation. Terminal knee extension (TKE) exercise. Place the ball under your ankle, tighten your thigh, and fully straighten the knee. TKE in prone position. Lie on your stomach with the knee slightly off the bed. Tighten your quadriceps and straighten the knee fully. This improves terminal extension and quadriceps control. SLR at 30°, 40° knee extension, seated line. Keep the knee slightly bent at 30 to 40 degrees. Lift the leg slowly without locking the knee. Focus on controlled quadriceps activation, not momentum. Sideline SLR, VMO focus. Lie on your side with the top leg straight. Lift the leg slightly forward and up. This targets VMO activation and improves knee stability. Seated gym ball press, 90 degrees hip and knee. Sit with hips and knees at 90 degrees. Press the foot firmly into the ball. Hold and release. This safely activates the quadriceps early. Prone hamstring strengthening, 90 degrees knee flexion. Lie prone with the knee bent to 90 degrees. Gently pull the heel toward the buttock against resistance. This strengthens hamstrings without stressing the graft. Assisted iliopsoas stretch, Thomas position. Lie at the edge of the bed in Thomas position. Relax the hanging leg while the therapist assists. This restores hip extension and reduces anterior knee stress. Assisted calf stretching, line. Lie comfortably with the knee supported. The therapist gently stretches the ankle upward. This improves calf flexibility and ankle mobility. Patella mobilization, inferior glide. With the knee relaxed, glide the patella gently downward. This improves patella mobility and knee flexion range. Always performed pain-free and under guidance. Stand on the Bosu ball with equal weight on both legs. Maintain knee alignment and steady balance. This safely trains proprioception and neuromuscular control in early ACL rehab. NMES for quadriceps with active knee extension. Electrical stimulation activates the quadriceps muscle. Actively straighten the knee during stimulation. This accelerates strength recovery in early rehab. Active assisted knee flexion, line. Lie on your back and bend the knee slowly. Use assistance to guide the movement. This safely restores knee flexion without overload.